Dr. Luois Machogu, he is the president of the Pharmaceutical Society of Kenya. He's our guest this Health Friday. And to welcome him, CT has the day's proverb from Namibia.
Yes, this is our final proverb from the Republic of Namibia. As soon as a monkey has climbed a tree, it starts abusing from its elevated position.
Say again.
As soon as a monkey has climbed a tree, it starts abusing from its elevated position.
As soon as a monkey climbs a tree, it starts abusing from its elevated position. Terry? What's the interpretation of this proverb?
Very profound. Sasiji, who is being called a monkey, but what's actually, it's actually very apt for me because I'll take the angle of professionals. You know, society gives us the mandate to serve them as professionals, but we go up there and sometimes we get carried away. So I think I understand that proverb and I'm challenged by it.
You forget your true calling and the trust that's been bestowed on you.
Yeah. It's actually a social contract. It's the public who have said we cannot treat each other. Let there be a profession called pharmacy. Let them deal with, be experts in medicine and take the responsibility.
And what they tell us, we shall follow.
Yeah. And can they also be accountable and do the right thing?
Yes.
Yeah.
That's very true. So the Pharmaceutical Society of Kenya, what is it?
Yeah, so thank you for this opportunity. The Pharmaceutical Society of Kenya is the umbrella body of all pharmacists practicing in this country. There are 5,000 pharmacists whom the country has registered to practice the profession, the noble profession of pharmacy. We are charged with policy advocacy, public awareness. What is the role of a pharmacist? Many people don't know what the role of a pharmacist is. That's what we do. We create awareness. We are available on our website is www.psk.or.ke. We have a YouTube channel. We have a lot of awareness campaigns, medical camps, training of our pharmacists, upskilling them, linking them with international standards, WHO. That's what we do, and ensuring that standards. Also, we uphold the code of ethics. Because a profession is not a profession, no, if they don't abide to a code of ethics.
By some code of ethics.
Yes.
Who's a pharmacist?
It's a good question. So a pharmacist is a healthcare champion. I would say it's a pharmacist is that person, that intimate person you work with in that healthcare journey. If you want to get well, you want to stay away from an illness. Let me use a personal example. I remember I've asked for permission from my dad, when he retired in 2000. Unfortunately, he had an illness, a chronic illness. At that time, I was studying at the University of Nairobi, and he had hypertension. I'm saying he had because he doesn't have it anymore. And I remember him worrying, what will I do? How will I afford this medicine? Because his employer used to pay for him his medicine. At that time, it was 10,000 Kenya shillings. He's retired. His pension is not even, that's almost like 20% of his pension. So he's worried. And it's actually even making his case even worse. I remember him reaching out to me and asking me, I know you've gone to study pharmacy. Is there someone there who can help me with this condition? And I was able to onboard him on a program with one of my lecturers. So a pharmacist who sits down with you at the primary level. What did the consultant specialist say? Have you understood? What challenges are you having? So the patient will be able to say something like, oh, I didn't understand this medicine. Or you realize, okay, so let's tell the doctor. And we work as a team. So a pharmacist is that coach who helps you understand what are the treatment goals, where are you going, what do you want, where are you now, what's preventing you from getting there, and we work with you and to your road to recovery. And that's at the primary health level. Pharmacists are also involved from drug discovery to drug supply, importing it, manufacturing it, and also availing it to the patient at the last mile. Yeah.
Are they involved at that level? Because, look, when we think about going to access healthcare, you do your triage, you go to the specialist, they see whatever's going on, you may be sent to the lab, and then you come back to the doctor, they do their thing, and they tell you, go to pharmacy. The interaction is, well, this is what the doctor said, here is your medicine, let's keep it moving. There really is little to none interaction beyond that where are my drugs, let's go. So what I hear you saying is that it ought to be, or are there instances, unless you seek the specialist care from a pharmacist, from the pharmacy, where would that interaction then take place? Because usually we take what the doctor has said in terms of a diagnosis, and then we hear that the dispensing of medication or treatment then comes from pharmacy.
Yeah.
So where does this interaction take place?
Actually, the interaction is that's a very good observation. The interaction happens at the point of care. You went, saw a specialist or a general practitioner, and you are given a prescription. That's where it starts. Because someone needs to interpret that prescription. Someone needs to understand, are you taking other medication? Are you even the right patient for this medication? Yeah. However, there's been a challenge. And this challenge comes from colonial times. Yeah. We had a situation where when the colonialists left, when they were here, they didn't allow professionals to be trained. So we didn't have pharmacists trained. Yeah. Now, because of that, we started training pharmacists in this country under a presidential declaration in 1972. That's when now pharmacists started being trained. So the numbers were always low. When I graduated in 2005, we were only 1,900 pharmacists. Yeah. Right now, we are at 5,000, and they're actually unemployed pharmacists. The problem has been, because there are few pharmacists, what the doctor had to do, everything. Prescribe for you, tell you everything, but now, the doctor doesn't have, we are many of us. Doctor doesn't have time to counsel, and that's the case.
On how to use the
medicine. Because actually, theirs is just to identify the issue that you have, identify the medicine, and work with the pharmacist to give you, because we're all working, the patient is in the middle, so there's a doctor here, there's a pharmacist, and maybe the lab, because we're all meant to work as a team. But because of that, maybe in the past there used to be few pharmacists in the country. Now that is not the case. So we are saying the case now is, you as a patient, can we move from the old way of just saying, here is a prescription,
give me the medicine,
nipatie kenye doctor amesema, that's all.
Stop arguing with the doctor.
Come give the medicine, sema shida zako. There are patients who come and give you the prescription, they know very well they'll not take the medicine. And they feel embarrassed even coming back to the doctor and say, I didn't take the medicine. So they lie. They say, I took the medicine. But the problem, the same patients come a few years down the line, they are having their leg amputated because they didn't comply with the medicine.
It's interesting that you say that, because again, it's usually that this is what the doctor has said, so the pharmacist will dispense according to the doctor's instructions. My mother is a pharmacist, and I would see her at the pharmacy. People would come with a prescription, and doctor has prescribed 1, 2, 3. And because of the
in a handwriting that only a pharmacist
can read. I used to also ask. But then she would also suggest, and she would say, you know what, this is your medication. But because of my understanding of pharmacology, how about I ask you to also add some vitamin B? Or how about I say you add this to this, because I understand what's happening here. Is that what we're talking about? That the interaction then can be more complete, because then you understand the makeup of medicine and the work that it will actually do in the body, as opposed to, here is 2 pills, take them 3 times a day.
Actually, I would say it's spot on. Patients actually shortchanging themselves when they come to the pharmacist, and all they say is, just give me as is. You're leaving so much on the table. That pharmacist is able to even make intervention, because remember, this medicine could have drug interactions, like you're saying. There's a medicine we need to add, number one. There's a medicine we need to remove. There's a medicine we need to stop, and maybe remove and replace, or medicine just stop, because now it's no longer in use. You find patients who've been taking medicine that are causing ulcer, a painkiller that's causing ulcer, and they've been living with ulcers, but they've been taking the medicine because it works. No one has because I got a prescription. You never got to spend 5 to 10 minutes, which is the recommended time you should spend with your pharmacist.
But let me ask you this question.
Yeah.
Then the pharmacist, even in a hospital, should be behind the counter. Should then also have a booth so that when you leave the doctor, you go to the pharmacist before you actually go to where the medicine is dispensed. Because in all honesty, when you are at that counter, there are very many of you. That pharmacist will have the same challenge as the doctor. He will not have the time to explain.
Yeah.
So, but when you are sitting...
It's a consultation or
Exactly.
Yeah.
Yes.
Yeah.
The doctor has time because it's you and the doctor. We don't have that with the pharmacy. Because the practice that I see in hospital is an assembly line.
Next.
You hand it over, go and sit down over there and wait.
You'll be called.
City Muga.
Take this one 2 times a 3.
Any questions?
This one 10 times a day. This
a
one
lot of water.
lots of, in fact, plenty of water. You especially. Yes. Then, so that opportunity is missed.
Yeah. That's the old design of the assembly line, like what you're saying.
Is it old? But it still exists.
No, we are actually seeing it moving.
Like where?
So let me give you an example. Go today to MTRH in
Moi Teaching and
Referral Hospital in Eldoret or Kilifi County Hospital. Yeah, let me use public
we have
hospitals.
been to Kilifi Public Hospital, so tell us.
Yeah, the county hospital.
we are listening.
Even Coast General, where I also doing my internship. Yeah, you'll find there are specialist pharmacists first of all who do ward rounds. Yeah, so you've been admitted to a hospital.
You're under a certain regime of medication or treatment.
You have an illness, you've been prescribed medicine. There should be a pharmacist who goes with your treatment sheet and see what is the progress you are on. If you're not getting that, you need to demand.
This is absolutely new.
Yeah, it is actually happening. And I'm saying public hospitals so that even the private ones can say what are they doing. Yeah, so the public should demand for this service because they are there.
You know, you're saying that a pharmacist is supposed to do this and they are allowed by even the law.
Yes.
Because it sounds to me like a pharmacist is also participating in the prescription.
Yeah. It is called drug selection. You know, because this pharmacist has been, as we have just heard that the pharmacist also has been trained in the pharmacotherapeutics. Yeah, they understand this patient. They actually clerk the patient and find out what are you on. What are they look at the entire notes and work as a team because it's about outcomes. Create a treatment plan right when you are in the inpatient. Yeah. So you have clinical pharmacists. That's what they are called, and they are there in Moi Teaching and Referral. They are there in Kilifi County and even Coast General and many other hospitals. Yeah.
The many things.
Let's start there. And the Pharmacy and Poisons Board is a regulator that gives them that right to be able to practice at that level. Yeah, so they're actually registered to practice.
You know, I'm asking that. It's because of what we are used to. Now, when you go to a pharmacy and the person starts telling you, we're changing this and the other, you always feel this guy is either he's in business. He's the one who is selling me the medicine. So he's basically changing. He's changing what the doctor has recommended for me so that he can make an extra buck out of it. Or because he doesn't have this medicine here, he don't want to send me elsewhere, so he's giving me something that is a substitute that may not necessarily work as well as my expert doctor recommended for me. So you're saying that actually a pharmacist should be involved in this
drug selection.
What a doctor, after they sit down with you, they identify what the issue is, what their prescription is. I'm prescribing this kind of treatment, and then you also now come in and say, all right, so understanding your history, your body type, your everything, what else you're on and all, this is for this treatment that the doctor has prescribed. This is the actual product.
Exactly. Yeah. So it's actually the doctor prescribes for you water. Now you come to the pharmacy. Actually, the pharmacist is standing there with the doctor in the ward round, for example. But in the community now, at retail level, the prescription came from somewhere else.
Yes.
So when you come at the pharmacy, the first thing you should do is first look at the credential of the person who's, because there are also many people out there who are masquerading to be pharmacists.
We'll come to that.
So you should be able to. Every pharmacy should present their credentials. They actually even have a photo. I mean, if you're entering an Uber and you actually look and say, are you the driver? Before you even are served by that person who says they are a pharmacist, ask, are you a pharmacist? And at the Pharmacy and Poisons Board website, you can actually see their photo, even it's the same thing that is there.
Okay.
Yeah.
But a president.
News. Am I sharing news?
It's not news. What you're saying makes perfect sense.
Okay.
But who beyond, apart from you, who else has this knowledge?
Who knows this?
These things, yes. I mean, in all honesty, even those who are listening, how many of you know that this thing actually is supposed to happen?
Actually, it would be nice to hear Paul from the listeners.
Let's see by comment on our YouTube and Facebook. Those who are watching the live stream,
and that's why we are here.
Do you actually know? Have you come across what we are hearing from the president of the Pharmaceutical Society of Kenya, Dr. Luois Machogu? In terms of how pharmacists should and how they have started working. Now that we have more and more pharmacists being trained and being registered in the country, are we seeing that? So once you go to this pharmacy, you're saying we've identified that the person that you're dealing with there is an actual professional.
A professional.
Is the person behind the counter only a pharmacist?
It's a good question. So in the country, there are, at the patient-facing end, there are 3 people who are allowed to handle medicines, because medicines in this country are scheduled. There's narcotics and controlled medicines. That is only a pharmacist who's meant to handle that medicine, because there's some training and competence, because someone can actually abuse it and become dependent on it, or even you misuse it, or take it and go and use it for another purpose. We've seen it's happened. So the next schedule is prescription only. So you get a prescription and someone is able to dispense that. Then you have pharmacist only. Then you have pharmacy only. A pharmacy only will be handled by a pharmacy technician under the supervision of a pharmacist, so that you have access. There are places where pharmacists aren't there. I used to work in Samburu. You have, in the offshoots, you have pharmacy technicians. So then you all collaborate. Because remember, it's for the patient. Then the last one is Dukala, in the supermarket. You'll find some medicines, Panadol, and things like that. So those are the 3 kind of people. So there's a pharmacist, there's a specialist pharmacist, there's a pharmacist, pharmaceutical technologist, and the ILO.
So this let's start from in a hospital. When you told,
who will you find?
End up like a pharmacy. Who will you find?
You need to find a
hospital
pharmacist. You need to find a pharmacist.
That's a pharmacist that will be there.
You need to find a pharmacist.
But do we find pharmacists?
So we are finding some hospitals like cutting corners. And they give you someone. So they might find, you might find they have a pharmacy technician, as is known by WHO.
Okay.
Or sometimes you find they're not even someone who has been moving around in the hospital. They've been cleaning around here, and they're hearing Billy Maratatu. Then they put that person there because they're cutting costs.
Or someone who can read the doctor's handwriting.
Yes. They will pretend that they can read. But yes. Please.
In what crazy circumstance? Well, I guess it's not so crazy, because if it's something that can be documented, it happens. That you would have some random person. Okay, you've been here, you've heard the word tetracycline four times.
Amoxicillin.
And you know that if the diagnosis is bacterial infection, we know, okay, we can give amoxicillin. This person is then allowed to be behind the counter and dispense medication based on prescription without an understanding of what's really happening. And that's okay. I don't
Actually, Okoh, you're right, and it's actually sad. It's a sad state of affairs, and it's not where we want to be as a nation. But so we have the role is 2-pronged. There's the public need to also ask, who is this who's serving you? Because you're the one who's taking your patronage to this place. Who is this who's serving you? Do they have the qualifications and competencies to be able to serve you? And you're seeing someone who we've actually been seeing cases where a patient comes to you, has been taking liver antibiotics, diabetes medication. They've been taking the same medicine, maybe like if you've been prescribed for Desani, you are given because they don't know it's another brand called Aquamist, they gave you both Aquamist and Desani at the same time. So this patient has been taking to
Double.
double dose of, and that's why they're collapsing. Their diabetes is not getting better. So it's very critical. That's why we're saying at that point where you are receiving your medicine, discover first who is this who's serving you.
So we're going step by step in my question. So in a hospital, that pharmacy should find a pharmacist.
You need to find a pharmacist. All level 4 hospitals upwards
and above.
You should find a pharmacist. Level 2, 3, you need to find a pharmaceutical technician who then works under supervision of a pharmacist from level 4.
So there'll be a pharmacist from level 4 somewhere, but then this
they all work as a team.
Technician is also trained, is a KMTC trained and such, right?
Yeah.
Okay.
Yeah.
In these things that we find in our estates, 24-hour pharmacy.
Yes.
24-hour pharmacy. Yes. We can't have 5,000 pharmacists working in public hospitals and working in 24 hours in a public pharmacy. So who are we finding in these 24-hour pharmacies that are across the country?
You'll be, and we need to challenge our members of public, and I think I want this to be participatory.
We are people are commenting.
Go around and look at your favorite 10 pharmacies in your neighborhood. Go and do a poll. The person, they need to give you the credentials. Confirm. You'll find out of every 10. You'll find out of every 10, 2 might be pharmacists. 2 will be pharmacists. You'll find 4 at technicians, and the rest you'll find are quacks.
Interns. But let me ask you.
Are quacks. Quacks. They have no training.
Like me
whatsoever.
Now, I go and
because you have the money, you started a pharmacy,
and
maybe there was a need. To be honest, there could have been a need.
But El Presidente, who is allowed to carry a license?
And who licenses?
Yes.
So, City, that's a good question. Who licenses is the Pharmacy and Poisons Board.
Okay.
They give a license to, according to the schedules that I've just given, they give a license to a pharmacist and a pharmaceutical technician.
They both get?
They all get licenses according to their scopes of practice. The same way, and actually right now we have a third license of a specialist pharmacist, the one I told you who is in the ward rounds, who's working with the neurosurgeon,
top level.
Like that, because we need progression, career progression, and so that we can serve the country, the way globally. We should not all go to South Africa or US because of this. We need to have competencies there locally. So these are the people who are licensed to serve Kenyans. Yes.
What's the difference between a pharmacy and a chemist?
A pharmacy and a chemist. It's just terminology.
An apothecary.
An apothecary. And nowadays you're seeing chains of pharmacies coming. It's just a language that they use. And what is happening with the Pharmacy and Poisons Board to help us differentiate the levels of practice? The Pharmacy and Poisons Board, together with the Pharmaceutical Society of Kenya, we are working to differentiate pharmacists, where you can actually, to make it easier for you to see a pharmacist, and you'll be seeing a green cross there. You are going to a pharmacy, you see a green cross, at least it alerts you that there's a pharmacist there. But even when you go inside, demand to see the credentials so that you're able to see who is this who's serving you, and are they serving you as per their levels of competence.
Wow.
Because remember, Eric, let me just add something. The constitution of the country under Article 43 demands that you need to have the highest level of healthcare. But go further to Article 46. It says you have consumer rights. No one should, actually even that pharmacist, if they mishandled you in a way or the other, of the technician or that person who's masquerading, you have a right to seek redress from the Pharmacy and Poisons Board, and PSK is there to help you on that matter.
The president of the Pharmaceutical Society of Kenya, Dr. Luois Machogu, is our guest on this Health Friday, and we are asking you to share with us your thoughts, everything that he's told us today in terms of what we should expect from pharmacies. Is this news to you, or is it something that you knew to be happening? Sample some of those comments. What are people saying? Have they ever heard of these things that Dr. Machogu is telling us?
Well, interestingly, so no. Most pharmacists act like technicians and technologists despite their 6-year training, only interested in dispensing. This is one thing that somebody says. Moffat says this is actually true. Pharmacists play a pivotal role in medication therapy, management, and in fighting antimicrobial resistance. The question is, do pharmacists still give their licenses to quacks for display at the pharmacy chemist shops and get a return for that? The quack operates under some kind of license. In my year experience, okay, so what are we looking at here? In my year experience,
Scroll up. Inakata kuscroll.
Voila. In my 6-year experience, the only pharmacist who ever attended the ward round was at Nakuru PGH. God bless her soul. Can't recall the name, but she was one of the great help. So that was something that stood out. All the pharmaceuticals should have inspectors, is what somebody says. Qua ground, mambo need different. That's what the majority of doctors will direct you to their own pharmacy shops. And are you sure pharmacists can alter a doctor's prescription, even suggest medicines? Isn't that why we have drug resistance cases? This chairman is showing us that pharmacists are very smart, articulate people. Okay. First of all, we need to ask this if the pharmacist will be paid consultation. So this is it. That first of all, there
you
is.
start introducing that other room. Any extra room is more money.
Yes.
Yeah. Interesting reactions, and do thanks for reading for us those. And I mean, you first of all, you said something about quacks, and like I said, if we went and sampled, you'll find that and this is a challenge of a developing nation. Yeah, like I said, we didn't have enough pharmacists. Today we have, and I think if you've had KMPDA before, there are actually over 4,000 unemployed doctors, pharmacists, and dentists. Yeah, medical doctors, pharmacists, and dentists. And this begs the question: if you're not accessing a pharmacist, what is the issue? The issue, and I think let's empower ourselves. Like I said, Article 46 of the Constitution empowers you to get. You have consumer rights. You need to demand. You're the one who's going to pay for those services. You're not unempowered. You're actually empowered by the Constitution. You should actually go ahead and demand and say, are you a pharmacist? Now, you have no business going back to that pharmacy if they don't have a pharmacist. Now, there are things a pharmacist should do for you. They can help with your... The prescribers prescribe the medication. It could be a clinical officer, or it could be a pharmacist, a medical doctor, yeah, or even a specialist.
Okay.
Yeah, the prescription has come. Now, you can't afford the prescription. Now, the pharmacist sits there and understands. Okay, could there be a generic? Could there be an alternative? It's not the end. Now when you find a quack or someone who's not a pharmacist, what they'll do, they just give you half the dose.
Yeah.
That does not serve you. Yeah, you need to get the full dose. So with a pharmacist, they're able to look at the economics part. They need to look at holistically of you. What else are you taking? Yeah.
Right.
What else are you embarrassed that you didn't tell the doctor?
Right.
On that other side. Oh, I haven't been taking this medicine. I've just been going back there. Yeah. Now the pharmacist then works in an interdisciplinary. We are at the same level with your medical doctor. I'll call and say, by the way,
This patient.
we are working for this patient. This is the problem that they have right now, where they have to eat cassava meal every night. Now, cassava meal interacts with this medicine in this way. Yeah. Can we make the prescription to be in the morning?
Okay.
Yeah, this patient feels that they have this medicine gives them impotency. They have not told you. Yeah, but me as a pharmacist, the patient trusts me. Yeah, or I have more time with them, and I'm able to come back and relay that information. And together we work and alter that prescription and give you the one that you'll go home with
for you,
and give you a treatment plan that works for you. We are not working here for drug manufacturers. We are here to work for you as a patient, so that you get, and everyone else gets to benefit. Yeah? That's really the role of a pharmacist.
Joy Salamu asks an interesting question here. How will people ask for credentials? How do you do that? Somebody's behind the wall, has won the lab coat. You say, I want to be sure that you're a pharmacist. Show me your ID. I mean, and then can there be a database of licensed ones? I think you alluded to that, for people to use to counter check with photos, names. You said that exists.
It exists.
But I'm imagining that the majority of people who are seeking treatment, number one, don't have that wherewithal to go on and be checking if this person's picture appears there. And at that point, really, the concern is treatment. Like you say, sometimes it's, will my shilling actually be enough for this money that I'm spending? Because we still do have a lot of majority of the spending for treatment is out of pocket without social funds kicking in and all of that. So at that point, is that individual vested in, is this the person usually the white coat is the emblem of
Authority. Yeah.
So if that is one, it's understood this person knows what they're doing. So then to start to ask the question, but then also there is this huge danger, because I hear what you're saying is that there could be a lot of people today who are being treated with medication that if there was a conversation had, it could be tweaked a little bit and we will see a better offering on health. That's a big thing. It's a big deal that we should actually be thinking about. That are people then consuming medication that they ought not to be? You know, how do you start asking the question of, are you a pharmacist, before I start telling you, are you sure you're not giving me something that's going to interact with what
Mr.
I'm ingesting?
Is that really the patient's duty? I mean, if you have a board that licenses and ensures that people who practice as pharmacists have the qualifications, should they not then go the extra mile to ensure that where they apply their trade, whether it's in a hospital or not, that the person whom the patient is encountering, because I want to take this thing to its logical conclusion.
Okay.
You go to a school and you're told this is teacher X teaching your children. Say, excuse me, I want to see your qualifications.
Your TSC number.
Let it. No, TSC number, I forget. Your qualifications. TSC number you could have created. This is Kenya. Umesoma mpaka wapi? Okay, who was your classmate? What I'm trying to say is, if you take this argument to its logical conclusion, we'll ask this of everyone, but should they not be, for instance, you don't ask an MP to remove their credentials. We know they've been elected because we know the process, and we see them taking the oath of office, and they're MPs. So we know they were Shimua, and we also know they were Shimua for 5 years. Now, surely, when it comes to something as important as the business
Of
that yes, exactly, should then not the board that licenses these people?
So you want the regulator to be more, proactive in enforcement.
Yes.
Actually, the regulator has been proactive. If you see, time to time, they do crackdowns. And the problem with that is you go to Huruma, Karen, you've started on this road doing a crackdown. Someone has already sent an SMS or WhatsApp, and everyone else has,
but doesn't it occur to you that you're doing it wrongly?
How else could it be done? Nyumba kumi.
Don't do it. Don't do crackdown.
It isn't a
Regular.
crackdown. Yes, I mean, how do you ensure
Spot checks.
precisely? Because a crackdown, as you say correctly, it's like with the alcohol blow. You'll arrest the first two people. After that, an SMS will be sent, and everybody will know the police are in this place. This is Kenya. And also, a crackdown is punitive. Why is it that we are not ensuring that the people who are actually serving the citizens are actually who they are? Okay.
So let me take this back to the power. And I think, you said something about who has the power. Yeah? I would say the person who pays has the power. In this country, maybe 15% or 18% of healthcare costs are paid by insurance. So that person has the power.
Right.
Yeah? That person can say, give us your credentials before we onboard you, so that when you're sent to our patients there, they'll be served right. That is not happening. So we are creating awareness that should be happening. Number two, the other person who has power is the patient. The person, the caregiver or the patient themselves, because they're paying with their shilling. If today someone was going to build for you a house, you'll ask for the credentials. You asked it once. Then thereafter...
Actually, no.
Yeah?
No. Most people don't ask.
You don't ask?
No, use reference. Where has he built?
That's the
reference.
Yes. But now you need to go a step further, because you only do it once. Because once you do it, and I need to encourage if you have a chronic illness, you shouldn't be hopping through pharmacies. You need to have a family pharmacy. A place where...
keep your history.
Yeah, you keep your history. You're not just jumping, so that you can get value from the entire healthcare continuum.
Right.
So I think we are saying, let's be empowered as well. We know the challenges of the government, government agencies. If government agencies if you challenge them to do this better, they'll come back to you and say, give us more money. Yeah. But we as the consumers, we are the ones paying. We actually over 80% of us pay cash. Yeah. We should actually go there and say, I have a chronic illness, and I want a treatment plan on this ailment. Yeah, I've seen as a pharmacist through my colleagues who are specialists and others as well, who have taken many patients off chronic medication by diligently working with you, and that's the value we want. We want actually in 10 years this is our strategic plan as PSK. Yeah, we want in 10 years every patient has a family pharmacist. Yeah, in the spirit of bottom up, community empowerment, so that you are actually empowered to my diabetes should not be your story. You shouldn't be owning you should only be owning my pharmacist or my
a healthcare provider.
We are working towards eliminate the enemy is one.
But you're saying, President, as a basic minimum, when you walk into a pharmacy, there should be at least a license.
Yeah, a photo
there should
license.
be something there that I see.
Yeah.
First of all, that this facility is licensed.
Yeah.
And that the people who are here, these are their licenses.
Yeah. To make it to make it easier, it should actually, if someone cannot frame their license, there's something wrong there. Yeah. They should actually print it in color, because it's given annually. A photo license, annually given, printed in color and framed, together with their membership to the Pharmaceutical Society of Kenya. That's how they have subscribed to the code. They should actually print the code of ethics, and it's actually one page, and sign the things that they are saying that they will do for you. Yeah,
they'll abide by.
Yeah, and on the other side, of course, the license for the premises.
Okay.
Yeah.
Now, I have an issue about regulators. I can understand why the Pharmacy and Poisons Board would be regulating the pharmacies. Because we're talking about now the product that is in there. They're the ones that say this product is then allowed to be sold and be consumed in the country. So for every product that is in the country, it must be passed and approved by the Pharmacy and Poisons Board.
Yes.
I don't understand why they need to be the ones who regulate the healthcare providers, the practitioners. Because on the other side, we have the Kenyan Medical Practitioners and Dentists Council.
Yeah.
Why are pharmacists being licensed by somebody else, by a different entity?
And they're in the same forest.
Of course, there's, that's a good question. The tools of trade of a pharmacist is the medicine. Yeah, and traditionally that has been, they've been regulated together. But what we are seeing is a shift towards, in Africa, across Africa, globally, is to have a single regulator for all medicines, veterinary medicines, health products, radiology equipment, all those things in one place, regulated in one place. The different experts who are then sitting in those councils and to be able to offer their technical expertise. And that's why we have, currently we have the Kenya Drug and Authority Bill to do that. At the same time, PSK, together with the Ministry of Health, are working towards making a pharmacy practitioners bill that will regulate the practice of pharmacists and pharmaceutical technicians as they're recognized by the WHO and ILO. Yeah. So the spirit of that is to be able to give each focus. Yeah. Because the challenge we've been having in this country is the public are not confident that the generic medicine I got is of the right quality. Yeah. Or even the locally manufactured medicine. So we want a separate regulator to ensure from the animal medicines to the human medicines, they are all regulated in one place and focus is given to that. Number two, for practice, pharmacists again take on the other side. So you have a council just like the Kenya Medical, the Medical Practitioners and Dentists
Why
Council.
not join that council?
It's a good. Is there something that prevents us? Yeah.
As practitioners, you've already joined that as a union, Kenya Medical Practitioners,
And
Pharmacists,
dentists,
and Dentist Union,
yeah,
right? So
yeah.
doctors, dentists, pharmacists are in the union, but then you separate when it comes to regulation. Why? You've already shown the way. Why are you creating a separate bill that will take you away from this council?
What is the historical problem? Because this is clearly historical.
Yes, there is. You have to look at globally what is the practice. Yeah, and Latiff, that's a good question. Thanks for that. Globally, there's the best practice. Pharmacists have their council. You have nurses have their council.
Yeah.
You have dentists even have their. In some countries, dentists have their own council. Yeah, and so on and so forth. So ideally, if you're to ask me. And in Kenya, we took up the colonial laws, and we just took what has been there. We just domesticated it. But as we are saying, where we are moving towards, yeah. And I've seen KMPDU as a union has really helped us and worked, and everyone belongs there. So as the Pharmaceutical Society of Kenya, and I believe I can speak on behalf of all pharmacists, and even other healthcare workers. If you have a house, so what you're talking about is to have one house.
Yes.
What are the efficiencies that will come out of that? There'll be a lot of efficiencies. First of all, me as a taxpayer, I'll be paying to one regulator. One regulator. It's strong. It does
can
all.
Complain about a nurse, a pharmacist, a dentist.
You go to a hospital to
one.
register it. It's one place. Like that. It makes sense. Now we will have to use very Solomonic wisdom to ensure that the structure of this entity,
I think it's not going to work.
does not favor one person over the other, So
it's not going to work.
that is,
Why
if you're
is it?
asking me what is the challenge, the challenge will be, would
Sibling rivalry.
what is called civil, would we? But you see, it can work. Let me say it can work. Why?
Why hasn't it worked then?
It can work because all of us as professionals in this country belong to one umbrella body. It's called APSIA, Association of Professional of East Africa. Even you journalists, you belong, all of you there. All of us as professionals. So tutasema basi, all of us
President,
as
people want their own unions which they're in charge of. This thing, why is the East African community taking so long to sort out?
because
Because
each country wants.
precisely.
So if you're
a
asking me
pharmacist
why-
is not a medical doctor, a dentist is not a veterinary doctor. But the question I want to ask is, do those who are in the practice of purveying alternative medicine, do they fall under your purview?
The Pharmacy and Poisons Board.
Yes.
So there's a bill that's in place. It's called the Traditional Healers, and that's a practice. You have someone who gives you mitishamba, you go and
Hey,
give
how ni
you-
wataalamu wa mitishamba, eh?
that's the practice. That's why now will you lump all of us together?
Well-
How we let all practice.
You all have the same client.
You're dealing with one body.
The client is the
Bin
same.
Adam.
In a utopia, that should be fine.
Now you see, you've answered my
We
question.
are not in utopia yet.
Okay.
One day in that utopia President Kibaki saw in Vision 2030, we will get there.
So
But
there's a question also then going towards utopia, and I think it's something that's a big deal.
please. Yeah. No, Aris, yeah.
Bogwa and Jerry asked us really quickly, and I think it's important. Fake drugs, counterfeit drugs. You go to many pharmacists in the middle of the city, back street, whatever. How can you be sure that what you're getting is
It's legit.
legit?
It's legit, yeah. Now, first of all, the easiest way of ensuring that you get legit medicines, is by first ensuring that the person serving you is a pharmacist. In the developing world, over 30% of medicines, 10 to 30%, depending on the strength of the regulation. In Kenya, we are at a regulation level 1. The highest is regulation level 4 or 5, even 6. The highest in Africa is 3. Tanzania, Kenya, we are at 1. For you to have the confidence that the medicine in your regulatory system is safe, you have to make sure the person serving you is a pharmacist, so that they are able to ascertain the person responsible for procuring the medicine and because they are taking a responsibility. Like I said, Article 46 of the Constitution gives you consumer rights. You can actually sue that person if they gave you medicine of that sort of
So
the
to
right
be
quality.
sure that what you're taking is legit, first of all, make sure that the person dispensing it
Is
Yeah.
legit.
is legit.
Yeah, just start there.
So you have at least have something to hold on to.
Yeah. And you can sue someone if that happens.
Okay.
Yeah. Now, if you take yourself to a back street, then you are alone. Yeah.
Then the back street is legit. Dr. Ari, thank you very much for joining
Asante,
us.
asante.
Dr. Luois Machogu is the president of the Pharmaceutical Society of Kenya. He's been here this Health Friday educating us about pharmaceutical and pharmacists and the farm techs and what we should be expecting for our healthcare.
This is the Situation Room, the only way to start your day.